monitors also. And this whole floor wall here, that's the sleep laboratory. In total, as you can see by the numbers, we have 10 general rooms. On the intensive care unit, we have one measuring room for being able to measure patients who are seriously ill. On the neurology ward, we have 2 measurement places, and also in the pediatric patient center, we have 1. So putting all that together, it's 14 patients, the maximum which we can measure at one time. Usually it's about 8 people, 9 people at one day. We measure from Monday till Saturday morning, so right now there is no patient here, which is good because we can go into the rooms itself. What I will show you here is just first what the rooms look like, so that you get an idea on how a patient feels, how we do the measurements. I will show you some of our more recent and even old equipment on what we used to do, what we still do. I have some measurements which I can show you, especially with the most important disease we treat here, that's obstructive sleep apnea. I guess all of you know about that disease. Quite complicated, even if you use COPD, it's more complicated then. So I think the first thing to do is just have a look in one of these rooms, what it looks like when a patient gets in here. Just feel free to make photos if you want to. Hold on. Maybe just walk a little bit further. Okay, so this is what our usual patient room looks like. And if someone asked, what do you do at daytime here in the sleep lab? There's a lot to do, like getting the analysis of the patient, to do the physical exam, to ask them what kind of sleep problems they have. When we slept here overnight, we have to analyze the data from the night. We have to talk to the patients what we want to do. We can already check if we can use the treatment which we usually put to these patients quite well, or if there's any adjustment needed. So that's what we do at daytime. We also write the letters for the patients saying what happened, what's the disease, how was it treated then. So if we have a look at these rooms, the patient has a bed. Actually, it can be electronically put to whatever situation you want, because some patients just really like to sleep on their belly supine position on the side, maybe with the head up. So all that can be done. If there is anything we need, they just can call us, like on any ward you have here in the hospital. And if I talk about treatment, then this is, for example, what we use most. It's a CPAP machine. CPAP, that's for continuous positive airway pressure. So you see it's quite a small device. Can be taken even to holiday. And the good thing here when we do these treatments is we have a connection to the intranet here. So when we do the titration, it's starting with low CPAP pressure, and if we see there's still some apneas and so on, we can change it up from our monitoring room. So we don't have to get into this room, change something on that device. The patient can sleep without being interrupted. We need a lot of monitoring equipment. Nevertheless, you can turn around even at nighttime, since we have at least 2 or 3 nighttime students here watching all these different data. We see if some of the electrodes just went off, and we can get into the room and refit them. This is one of these devices where this is connected. As you can see, it's also connected to the intranet, and all the data is transmitted to the monitoring room. For example, in this one here, you can see like an idealized head with the ears, the nose, so that's where you put the different electrodes. We don't use that many though. For the neurologic ones, yes, but not for the usual patients. So there we just use the 6.
Polysomnography.
Correct. For the usual polysomnography, we just use the 6 channels. But for the neurologic EEG, we use the whole panel there. And you have a lot of other ones which you can use. That's, for example, the EOG for the eyes, the EMG not only for the chin, but also for the limbs. Sometimes, if we suspect some movement disorders, also for the upper extremities, we use the pulse oximetry, we use an ECG, we use the thorax and abdomen bells, and obviously either some flow and pressure measurement or the CPAP mask, depending if it's a diagnostic night or a treatment night. So that's the usual equipment which every patient here gets each night. In the past, it used to be 3 nights, 1 night of diagnostic, 1 night of, let's say, some rough titration, and the second treatment night was the fine titration. That's not covered by the insurance anymore, so it's a maximum of 2 nights for just the regular patients. So 1 diagnostic night, 1 treatment night. In the past,
You don't do split nights.
we don't do split nights except for some rare occasions.
Yes.
So most of the time we do 1 full diagnostic night and 1 full treatment night.
There's no light music,
Pardon?
light and soft music for the patient. Music.
Soft music, no,
Yeah.
actually no.
To sleep early.
Right.
Speak to the
if
phone.
he wants to have some music or whatsoever,
Yeah.
we have the television there. Though what we also want here is the patients to sleep. So I don't know the exact timing. I think at 10:30 at night the signal gets off. So whatever the patient tries, no possibility to watch TV anymore, because I mean he's here to be diagnosed, to be treated. When there is a big soccer event, some of these patients